Let me just throw a simple one out, then I'll do it based on what you just talked about, Joel.
Thanks for the simple one.
Yeah. So you talked about, actually related to the question I was going to ask, and so I'll just do it in a certain way, and that is, so there's a lot of fundamental research that goes into the genomics, understanding functionally what happens with different genes and so forth, and how the various mutations lead to a disease state in some way. And on the other end of the scale that you address here is the patient side. And there's a big gap between the two. And we have the ability to get a lot of data on the genomic side, and that's pretty good. It's improved significantly, so there's very few errors. On the patient side, there's lots of different things, very uncontrolled in general. So what do you see are the biggest gaps that exist between those two ends of the spectrum in terms of being able to make better decisions at the end of the day for those patients? How would you like to really ultimately, if you had no limitations, link that fundamental biological data with the patient data?
Right. So there's first of all, I'm not a physician, and I will address treatment options, in an abstract way. But I'll say that one big gap right now is that we're looking very closely at all the somatic alterations, but in no way are we taking into account germline effects. And so if you look at tumors like ovarian cancer, which have almost 100% have p53 mutations, same with like basal-like breast cancer, but they have very different clinical courses. They're still a heterogeneous disease. And so why is that? If p53 is the reason and there are no other consistent somatic mutations, then the idea is that it's something about the mutation on top of this germline genetic background. And so in order to overcome that, you're talking, now you get into these kind of GWAS type results where you have very small effects on very polygenic traits. And in order to address that in cancer is going to be an enormous challenge, given that we're having so much trouble even with the sparse data of somatic mutations.
So actually that gets me to a question I want to ask Jim, because actually we're dealing with an inherently either poorly known or even in some cases unknown science at the end of the day. We don't know enough about biology, although we've made great strides. So how do you bring in the cognitive and immersive sides? How do you fill in a lot of the gaps that exist in the data? Can we link it? Can we think about other things we've done that to that might actually help the healthcare profession?
Sure. So a lot of what goes on now, as I think Joel said in this talk, was a lot of things live in these silos. And a lot of what we're trying to do now is figure out how do we bring these together. Problem is, what one person calls one thing, a different group calls a different thing. We're doing some stuff with juvenile medicine, with children's medicine. And one of the issues is, what's a kid, right? In this study, they're going to 8 years old. In this study, they're going to 10 years old, things like that. So when we try to get to some of the science we don't know, a lot of what we're trying to do now that's new and where the cognitive computing comes in is we're trying to do it bottom up. We're trying to kind of get as much of this data together as we can. And we use these machine learning algorithms to say, what could you possibly tell us? Now, a lot of what we get is stuff we already know, and that is pretty easy. So the people who sneeze have colds, right? We get some very rare things like the things you're doing. And then we get a lot in the middle, and that middle ground is where we're starting to see some really exciting things happen, because now we can go back to the scientists and say, we see a group who are responding to a drug. So in this clinical trial, here's a few people who did above average, and we found that they have these things in common. Now, these may be things at the genomic level, but more likely in the kind of stuff we're doing, it's someone who had some particular treatment, or it's someone who's on some particular drug that wasn't controlled for, things like that. So now we can start saying, how could that cause that? So I think it's that we can use the data to help us actually figure out some of where the science may lie, and then turn that over to the scientists and biologists to say, how do we solve these problems?
So actually, let me switch. It may seem like it's very different, but I think it's somewhat related to Ronnie. I once had read or heard, and I could believe this, that there are essentially the same number of parts in a human cell as there are in an airplane. I'll use the A380. I've used other companies for other times I've said that. But when you get to, of course, we can design, build, fly an A380. We can't yet build a human cell. So how do you see the linkage of cognitive computing, immersive systems in a broad sense, and helping in what Airbus really is primary industry, which is in aircraft design, shortening design manufacturing cycles, among other details? And maybe we could say what you're actually doing at Airbus to address that.
Sure. I think, comparing the A380 with the human body is perhaps a stretch. I mean, we do monitor health of the airplane as it goes along. We do have diagnoses as well there. We try to react on those. That's really a comparison. I think where it becomes different, and as well, probably the mission criticality. If something goes wrong, there's really something bad going on. I think some of the cognitive elements, such as Jim mentioned, what we see is we have some amazing models that we use internally to build the planes, to test them, to simulate them. And then there's reality, where there are a lot of additional variables that we try to capture with thousands of, 10,000s of sensors. We collect petabyte of information for all our flights. But there is an amount of variability that we cannot easily model. So what we try to do on the cognitive level is trying to adopt based on what we can see on the reaction. So we try and test out perhaps different scenarios that we can play out in real time. We know that we don't have all the information. They are siloed. So we're using that also in different aspects. Sometimes it is siloed within applications. And we need it from a different perspective. So that's what we do a lot in manufacturing. In design, what we try to do there is somebody that designs a certain piece that has a certain functionality, but it needs to collocate with other pieces and sees how far it can stretch, let's say, a certain piece from the dimension. And it comes to a point where, another team says, no, you cannot go, there's a strut there that's essential. So these kind of interactions are very complex in such a big plane. So where we try to help with that in the design phase is really to visualize that, work collaboratively, and have the system help to see where there are limits to whatever you're trying to do in the solution space, given the functionality that we try to have overall.
Okay. Well, I'll get back to you guys in a minute on some, but I want to bring Aaron in. So, Rensselaer, like essentially all universities, we examine what we want to do in education very introspectively. How do we educate our students for the future? And that takes up a lot of our time, from the classroom to the not the classroom and related things. And so how do you see cognitive immersive systems impacting the classroom of the future? Anything from school, like high school or even earlier, all the way through to professional education. And we've heard a lot about MOOCs, blended learning, self-directed learning, the whole lifelong learning thing. How do you see all this coming together?
Sure. Pardon me. Maybe a moment before diving into the specifics, we'll talk about immersive education and the suite of technologies that are used. It's a very large suite of technologies. We started at Boston College in the mid-90s using virtual reality. And the notion here was that the students were coming into a classroom and I was standing up, kind of regurgitating lecture notes up to a big screen. And these things started to come along somewhere around there. The students were sitting here doing this while I'm talking to them, and I'm trying to...
Like the audience?
The audience is doing it too. And the initial reaction from a lot of the faculty on campus is put these away, turn them off. And my thought was, if my lectures aren't engaging enough, and I probably want to be doing this in the middle of class too, maybe we can use new technology that can better engage the learner. My background was in international standards in 3D and virtual reality at that point, and so I approached the dean of the college and said, I don't have to come on campus. We don't have to take up a classroom. The students don't have to take up a classroom, and we can immerse them in a learning experience that is considered experiential, where instead of me telling them about something and showing them something, they put on a virtual reality headset from their dorm or their apartment. I meet them in a shared virtual space. We go on a tour of whatever it is that I'm going to teach them, ranging from the pyramids of Giza to stepping into a cell and exploring the mitochondria. So from that point forward, mid-90s, once it was approved, the suite of technologies themselves started to improve, and we have what we'd consider traditional virtual reality. Put the goggles on, you may or may not have haptics, hand sensors or body sensors, but you have stereo vision and you're immersed in that. You have augmented reality, where you may have a headset that is allowing you to see the real world, but superimposing virtual content on that. You could also use it with your phone. And of course, the traditional simulations and learning games. These are all part of the immersive education technology suite. What that allows you to do, on one side, it's very easy to create an immersive learning experience. What's missing from most of them is a legitimate artificial intelligence. That's really the problem. What we have are scenarios and environments where visually they engage the learner, and so you can teach them a great deal through simulation and precision and repetition. But when it comes time for the student to actually ask in-depth questions that they need answered as an individual, that's where the artificial intelligence of today falls short. It really requires a skilled faculty to understand the student, where they are in the learning process, and feed them the information they need in a way that they can understand it. Not all learners are the same way. Cognitive computing, I think, holds the potential to make these immersive learning experiences as rich and dynamic as a real-world, one-to-one personalized learning experience. And if we can achieve that, what it means is that the learner can basically be guided along as if you had a professional guide with you 24/7. And it can start very early and go all the way through lifelong learning. So there's huge potential, but right now the AI is flat and mostly dead. You still have to have the faculty join you in order to give you a completely rich experience.
So Jim, anything you want to add related to the educational side? I know you've thought a lot about these things, both within CS and more broadly across campus.
Yeah, well, as you know, one of the projects Dr. Jackson talked about this morning was the Mandarin project. And some of what we've been trying to do is to add some intelligent agents into that for exactly the things you're saying. What's interesting is one of the things that's come out of that has been an exploration. The system we were using to build the knowledge base for the intelligent agents, the students we realized were learning more building the knowledge
Building the
base
system,
than
yeah,
by using it.
You're immersed in the information that's going in, absolutely.
They're thinking about
Yeah.
what to do, how things connect, things like that. It also led to us developing a whole new browsing technology, saying, okay, when I'm looking at this, what's related to it? But also the system's able to make suggestions about things to do. So this is work I've been doing with my colleague Mei Si, who is into narrative and sort of storytelling technology, and also with someone in Hongji, who's one of the top experts in information extraction. So now what we're trying to do is put together those things. So we want to be able to go to a bunch of documents, pull out the relevant stuff, turn that into something you can browse, use Watson to sort of pull out the right passages for the kind of things you're interested in, and then try to do that in a way that's engaging. And that's where that whole narrative and storytelling thing comes in. So I think it's an exciting area, and we're really just at the beginning of it.
I think it is too, and you mentioned something that is absolutely true, which is you learn more about the learning experience if you're helping to construct it. Because in order to build it, you have to really understand it. And for that reason, because we are currently exactly the model that we approach. We have a couple of big projects, one with the Department of the Interior, a bunch of national parks. The Department of the Interior is responsible for all the land inside the United States. Tons of historical sites where it's taught in history, but usually in a history book. So we're rebuilding those virtually. But the approach that we have on that is to have the students build it. Because right now, for the reason that you cited, once you're in and you're building and constructing, they become immersed in the entire living history, and they walk out basically as experts. What we're lacking is the ability for the system to do that for other students down the road. Similarly, we're doing some work with the Louvre and also Smithsonian, and it's across the board the same problems. If you have them construct the immersion experience, they become very, very, very detail-oriented because of the construction itself. But that's not really a solution for everybody, because not everybody can construct these things. So what we need is that back end of cognition where the information's in, and the student, one thing that really destroys this whole immersive learning experience is taking you out of the moment. So when you're in an immersive virtual reality experience or a virtual world experience, if it's a properly constructed one, a psychological process of projection happens, and you believe you're in that environment. And if you ask somebody a month or two down the road, they won't tell you, oh, I was in a simulator and it simulated this. They'll say, I was at the Pyramids of Giza, I was looking for King Tut's tomb, we went on excursions. They tell you these things as if they really happened, and the studies have shown that as far as their brain is concerned, it really happened. The problem is in those experiences, when you stop and you want the student or the learner, the trainee, to ask a question, up pops a text box and they have to type in a 1 or 2 sentence question and they get a 1 or 2 sentence back, and it just really destroys the immersive experience. What we really need in the long term, where I think cognition pays huge dividends, is natural interaction between the characters in these environments and the learners who are going through them.
That's great. So it shows a cognitive classroom becomes quite an exciting situation room and application that we're going to be dealing with here in the CISL. So we at Rensselaer, we have a theme for the current year. The theme is called resilience. And you can imagine it being relevant in virtually everything that's done, certainly in academia, in industry. Ronnie, there's probably no other industry that is impacted so much by supply chain and the resilience of the supply chain. So how do you envision cognitive immersive systems enhancing what Airbus needs to do, what all aerospace industry needs to do, in terms of the resilience of the network of supply chains that you have? And if you want to talk about specifically what you're doing, that would be great, industry-wide as well.
If I can, yeah. The supply chain is something that has been very much process-driven, rule-driven. What we lack often is a visibility into its effect and this bit of the history, the dynamics that it causes. So often we're in a situation where we're waiting for a piece, and this is a rather trivial matter, but it can hold up a plane rather than for 4 hours in a specific station up to a week. And that is dramatic for us. We have a big backlog. So these kind of things have huge effects, or some things that go on the supplier, can we switch to another one? So the ability to foresee that, the ability to have visibility up to the supply chain is hugely important for us. At the same time, it's also important for us in terms of cybersecurity. If we have the visibility of this, we can see certain threats coming in. I mean, sometimes it can be as obtrusive as an extra chip being on a little piece that comes in. So being able to monitor the normal way of things and then see any kind of outliers, saying like, well, this is not how it usually happens, can both help us predict or be more alerted, as well as react quicker to it. And that is the other aspect. Cybersecurity is probably a good example of virtual immersed reality capabilities, where we have a diffuse threat, and we don't know exactly where it's coming from, where it's going towards, and we need to explore that. And we have multi-model teams from different kind of domains, and they try to look at the data from different perspectives and try to collaborate with that. So that's I think where we can use these kind of technologies very well to work together. It's similar to what both Jim and Aaron said with regards to learning. We see that also with pilots to try to train them. We have simulators. We did that for years and years and years. But the fused reality is kind of interesting. That works also with the service and maintenance guy, where he sees the current situation and knows that the supplier stuff is here. We have that available. We know that this plane is in a different situation. We need to observe that. So have sort of a fused reality with what he's working on and the situational awareness of the system that can provide the information that's important in that very moment.
Any other comments related to that? I mean, Jim, I know you've been thinking about supply chain a
Yeah,
lot.
we've been thinking a lot
Maybe
about
more than you'd like, but
So, John, I think President Jackson actually mentioned some of this in her talk this morning, but one of the things we're really interested in is looking at this resiliency issue. So much of the supply chain work has been done based on economic factors. And when you design a supply chain, you're putting in things that replicate things, or things that you're saying, well, this shipping was highly, that usually works, so we'll keep doing that. And maybe we'll try this other one occasionally. But what really causes the problems is you get 2 or 3 things going wrong at once. Or you don't know that, so the guys you buy from are called your first tier suppliers, the guys they buy from are called the second tier, the guys they buy from the third tier. In an airplane or something like that, you can get 4, 5, 6 tiers. Think about that picture we saw last night, those of you are the 6 levels of cognitive. It's that same kind of thing. You don't know what's going on way down there, but that's gonna have more impact. So one of the projects that's going on in our Network Science Center is actually looking at cascading failures. How do we say, if this went wrong and this went wrong, that would be tragic. Okay, let's put in something to fix that. So let's make the supply chain less likely to fail if there's an earthquake in an, if we know all our 4th tier suppliers are in a small part of land, and that land is someplace they have floods or they have, you might say that's a bad idea. So now so again, it's visibility, but it's also using that visibility to do better planning and things like that. And just to throw in yet another plug for our cognitive work, one of the things we're working on here is how do we take the Watson technology that was used for understanding language and sort of use it for the dual, which is sort of planning. So when you read something, you're saying, what did this person do and why did they do it? Now you can go the other direction, right? What do I need to do? How could I achieve that?
Yeah.
So we're actually looking at some planning technology using Watson as well.
Well, just a quick add-on to that. So, I can completely concur with that. If you look at the final assembly line that we have for the planes, it's designed in a very intelligent way. It comes in here, then that happens, and this happens. And then in the reality, you see like, well, here we're in station X, and we're not supposed to work on that anymore, but there were some problems there, and that's why we caused it. There are constantly shifts of that. And the question is, should you always design your supply chain, your manufacturing chain in the optimal way of an ideal scenario? Or are you able to foresee, like, well, these kind of problems will appear. We cannot, digitalization will help perhaps, but they will always appear. How can we lessen their negative impact? How can we also give the line manager the visibility of, here are 5 things. I know that I have to work on that, but what are the impacts, negative impacts on them? Which one do I have to prioritize? I know it will delay, but what is the one that delays the least?
Yeah. Maybe I could key a bit off of exactly that comment in the conversation. Earlier I was asked about immersion and cognition, and I was talking specifically about intelligent learning environments where the agents are intelligent, the environment can track you and adapt over your lifetime. Certain applications could certainly do that with the proper cognition, but the notion of supply chain and cascading failures or successes applies directly also. That methodology might be applicable to the learning experience because basically I'm the Airbus that needs to go up in the air. I'm a student. I have to know certain things in order to progress. However, most students have gaps in knowledge. They haven't been properly supplied. The system hasn't supplied it to them or they haven't asked for it. And they get to a certain distance and you stall, especially in technical fields where you don't have the pieces or piece of information you need to proceed. A properly intelligent system could identify that and get you back to that stage with the information you need to thoroughly learn that so you can progress. So there's probably some general high-level models that apply to supply chain and intelligence chains that would be interesting to pursue.
Yeah.
You guys want to write a grant?
Yes. As a matter of fact, we probably should.
well, great, and then we got something out. So why don't we take a few questions to end the panel, if there are any. Is anyone interested in asking something, especially if it's really hard and really stumps them? That would be most appropriate.
So we have healthcare and drug treatments. We have education, and we have airplanes, all of which have certain safety risks associated with them. And I was wondering, we know the FDA regulates drugs and therapies, and there's a very carefully planned way in which cognitive is being applied on the cancer board, which of course you can comment on, but I was wondering if there are other things that you can bring forward in the educational space or in aircraft design that present certain quandaries for how to meet regulators' demands and safety risks associated with cognitive. Thank you.
We never beat.
Yeah, absolutely. I think, that's the regulations that we have to go through, the certifications are not only time intensive, but the fact that typically you need to test something, retest it again, and guarantee that it always has the same result. Well, for a cognitive system, that will not be the case. And on the smallest level and up to a larger level. So this is a huge challenge that we're trying to face, to decouple some of the mission critical systems from more cognitive system. They need to be on top of that. It's similar like the pilot. The pilot is not a deterministic machine, yet we can certify him sort of to fly. So the goal has to be really to reduce the error rates or help the pilot make better decisions. He has to communicate his desires and the mission goal to the system. The system has to help him with that to augment his capabilities on it. Yet the mission critical elements, as soon as he touches the plane, they need to be virtualized down and be isolated from it. So this is something that we're struggling with to define that interface and make sure that there is no barrier that can penetrate it through.
John, let me throw one other thing in. I think the dual of the question is really important for this audience and for people in our areas, which is helping policymakers understand some of the impacts of some of these things. So we do some healthcare research, which is actually for helping hospitals with their processes, things to get our hands on that data at the level that HIPAA and some of the other rules requires. We've had to do a tremendous amount of work, and I think we may be one of the few schools that's not a med school that's actually gone through doing it. But once you can do that and can actually look at real data, the kinds of healthcare savings that we could have in this country are just staggering. I mean, billions of dollars. We can save a single hospital millions of dollars just through their data. And so I think one of the things is somehow we have to help the people who are going to be regulating this world that has the cognitive stuff in it and help our students learn the policy impacts as well as the scientific impacts of what we're doing.
So you were talking about building immersive education systems and the sort of difference between a student who's engaged in building the system and becomes an expert and retains that knowledge, and the students who are then using it who have sort of difficulty maintaining engagement. And I was wondering if you'd thought about replicating that construction process more broadly by using the AI system to be the one that is being taught, and the student being the one who is constructing a lesson plan and actually teaching the particular AI that student cares about. What are the prospects in the near term for making AI agents taught by students that are convincing enough to be motivating?
Yeah, you're absolutely right. That is the direction that we're heading. And to the prior question, which connects a bit, I think, to yours, if I understood the question properly, it had to do with regulation inside of these immersive environments for education. Education is an interesting field because we don't have lives on the line per se, or it's not a medical field, but at the same point, you do have regulation on how you treat your students. So at the higher education level internationally, we have about 6,000 members, and the higher ed faculty basically get to decide what they're going to use for teaching. So it's sort of a self-governance. When you get into K-12, in particular public K-12, they have a very rigid, they can't really just take an immersive education system and put it in the classroom. There's a lot of administrative bureaucracy that goes into that. So the way around that and not having to deal with the regulations, we simply have clubs and camps that the kids flock to because they're exciting, the technologies are exciting, the teachers are excited about it. And so this is a way outside of higher ed that we've been able to get it into the school systems in a way that works. And broadly, to your point, broadly speaking, in every single one of these clubs and camps, they construct immersive learning environments. And the very next stage of that is populating and training the AI systems, which is really why I'm here today, because this is a very long-term project. Some of the projects we have are very small. They're with individual schools, and some of them are with governments. And we are now actively reviewing the solutions for us to be able to put as the back-end cognition into these systems. And IBM's cognitive computing is one that has, I think, a huge amount of potential internationally at the scope, so that you don't have to, you can basically plug it in and train it, and the students who are learning can interact and train, and by the time they're done, they've input, so without being hyper technical, they've input all the information by interacting through dialogue, and then the system itself is basically trained at that point. So you're right on target, absolutely.
Well, I think we're done. You know, we obviously don't have enough time to go through even a small subset of the applications that will come out of this, but at least we got a glimpse of some of them today. So thanks very much.